Cardiopulmonary resuscitation or CPR is an emergency procedure consisting of chest compression, often combined with artificial ventilation or mouth-to-mouth in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. It is recommended for those who are unresponsive with no breathing or abnormal breathing, for example, like agonal respiration. Cardiopulmonary or cardiac arrest is the cessation of circulation of blood as a result of absent or ineffective cardiac activity. In contrast to adults, sudden cardiac arrest in children is uncommon. Rather, cardiac arrest in children is more often caused by progression of respiratory failure or shock. In adults, it's mainly due to cardiac arrhythmia. But in children, it's not mainly from primary cardiac arrhythmia. It's mainly caused by progression of respiratory failure. So the most common cause of cardiac arrest in children is respiratory failure. The most important action of preventing death due to cardiac arrest is anticipation and the prevention of the occurrence of cardiac arrest by intervening when a child manifests in a respiratory distress or early stage of shock. The goal in pediatric resuscitation is to maintain adequate oxygenation and perfusion of blood throughout the body. An orderly sequence of events should be instituted immediately, beginning with the ABC of life. In addition, A stands for assessment of responsiveness, activation of emergency response system. So in the case of ABC, A stands for airway, as we know, but in addition to airway, A stands for assessment of responsiveness and activation of emergency response. So A stands for airway, assessment of responsiveness, and activation of emergency response. In managing a child with cardiac arrest, the first thing that we should have to do is to check the patient's responsiveness. Attempt to rouse the patient with verbal or painful stimuli. If no response, assume that the brain is no longer receiving adequate oxygen and continue the following management for cardiac arrest. Have someone to call emergency or to call somebody to help you. Once we identified the patient is not responding, the next is assessment and the management of airway. To assess for a patient's airway, use the look, listen, and feel approach. You should look, listen, and feel for breathing for no more than 10 seconds. Look, check for the chest to rise and fall regularly. Listen means place your ears close to the person's mouth and the nose to listen for breath sounds. And feel means place your hands on the person's cheek to feel for air. If the person is breathing normally, you should place them in a recovery position and continue to monitor their breathing till help arises. If the person is not breathing normally, you should begin CPR. Then the next is giving a rescue breaths. If the airway is patent and the spontaneous respiration is not observed, or the child is not breathing adequately, then artificial ventilation should be initiated. So give a rescue breathing. If it is a witnessed or in hospital using a bag mask device, give 2 breaths in a quick session and observe for chest raise. If bag mask is not available, perform mouth to mouth by using a barrier, using a plastic barrier device. Seal your mouth over the mouth and blow steadily and firmly into their mouth for about 1 second. Check that their chest rises. Give 2 rescue breaths. Continue with cycles of 30 chest compression and 2 rescue breaths until they begin to recover or emergency help arrives. You should be able to observe chest rise with this rescue breaths. If no chest rise is seen, reposition the head and reattempt breathe. After 2 breaths are delivered, assess for a pulse. In an infant or small child, the pulse should be palpated in the brachial artery. In older children, carotid or radial artery might be assessed. If no pulse is felt after 10 seconds, chest compression should be initiated. So, if pulse is not detected after rescue breathing, start chest compression. To perform chest compression for CPR, you can follow the steps. First, position your hands. Place the heel of one hand in the center of the person's chest and then place the other hand on top. To find the correct hand position in an older child, palpate the xiphoid process and place hands directly above this area on the sternum. In older children, place one hand on top of the other and push down onto the chest, making sure to keep your shoulders directly over your hands and elbows remain locked. Positioning your body, lean over the person with your shoulders directly above your hands and your elbows locked. Then push down on the chest at least 2 inches or 5 centimeters at a rate of 100 to 120 compression per minute. Allow the chest to return to its normal position after each compression. In young children, hand position is the same as older child, although only one hand is needed for compression. In infants, use 2 fingers in the center of the chest below the nipples in one rescuer. In the presence of 2 rescuer, encircling method is preferable. Then allow the chest to return to its normal position after each compression. And if you have been trained in CPR, you can also give rescue breaths after every 30 chest compression. So continue with cycles of 30 chest compression and 2 rescue breaths until the person begins to recover or emergency help arrives. So we call CPR a high quality CPR if it fulfills those criteria. The first is compressed chest, at least 1/3 of AP diameter of chest, or 2 inches or 5 centimeters. Rate at least 100 compression per minute. Minimize interrupting compression. Rotate rescuers every 2 minutes or sooner when tired. Allow complete chest recoil after every compression. Additional points include care should be taken during CPR to avoid compression of the xiphoid and the ribs. When available, a cardiac resuscitation board should be under the child's back. The child should have to lie on a flat and hard surface. To prepare epinephrine, 1 in 10,000, dilute 1 ml of 1 in 1,000 solution in 9 ml of NS. And if possible, prepare equipment for intubation and mechanical ventilation. The goal of CPR is to keep oxygen flowing into and out of the lungs and to keep oxygenated blood flowing through the body. This helps to delay tissue death. So once cardiac activity starts and the patient starts to breathe, you stop the CPR and continue the next care. In the majority of situations, prolonged resuscitative efforts for children are unlikely to be successful. So resuscitative efforts can be discontinued if there is no return of spontaneous breathing after 20 minutes of proper CPR. And we should have to also discuss with the family whether to continue or discontinue, and with our colleagues and the senior physician which is available around us. Thank you for watching.